Left, Right, in the Middle is made possible through grant funding by SRCI, the Student Research and Creativity Institute at Saginaw Valley State University. SRCI, your dream, your project, your research.
This issue is no longer about health care. This is about taxing. Every Democrat who voted for this bill said it wasn't a tax. The President of the United States says we're not taxing you. The Obama administration in court said if you don't like the theory of the Commerce Clause to uphold this bill, what about the power to tax? Justice Roberts says yes, the Congress has that power. Here's the problem. The Congress denied it was using that power. So it's my belief that every Democrat who voted for this bill should either accept that they tax the American people by hundreds of billions of dollars, or they should work with me to repeal and replace.
Yes, it was ruled that interstate commerce law was not how you could do this. You could not push down an individual mandate via that. But what you could do is make it a tax. But it's not a tax or increase on Americans. What it is a tax penalty. You can have a tax penalty. That's not raising tax on middle-class Americans. Like, on Fox News, literally, they'd be like, so if you're making $50,000 and when this goes into a place, that'll be a $500 tax on you. Actually, if you're making $50,000, there might be a solid chance that you have health insurance.
Hello, welcome to Left, Right, in the Middle. I'm your host, Scott. The opening audio clips you heard were South Carolina Republican Senator Lindsey Graham's comments following the Supreme Court decision concerning the individual mandate in the Affordable Health Care Act, and comments from TWIB, This Week in Blackness, another podcast, are responding to that claim. TWIB was actually responding to Rush Limbaugh's claim that ACA is the largest tax increase in the history of the world, and I'll discuss that claim a little later in the show. In the last episode, Healthcare 1.0, I ran through the history of healthcare in America over the last 100 years. And I did this to stress that this issue has been prevalent in our political discourse for a long time, and nearly every president over that time has tried to address healthcare cost and accessibility. I also offered my thoughts that we will never have a European-style socialized healthcare system in America, but we need to come up with a uniquely American system that places outcomes over profits while still ensuring that the various industries within our healthcare system remain viable. I also pointed out that one of the main points of opposition to the individual mandate contained in ACA was actually originally proposed by conservatives. And then I touched on what repealing ACA would mean and what alternatives the GOP is offering if ACA were repealed. So this episode, I'll be examining the Affordable Care Act itself, what's in the bill, what it means to individuals and businesses, other criticisms beyond the individual mandate, and I will probably actually touch on the individual mandate a little bit also, and ways the two sides can work together to strengthen the bill so that it does what it is intended to do, which is provide consumer protections, ensure that everyone has access to affordable quality health care, lower health care cost, and reduce the deficit. So my stance on ACA is that it isn't a perfect bill, and that's why I like to examine ways that it can be strengthened, but it does contain many consumer protections that were sorely needed. And personally, I'm for a single-payer system, which is a system that you go to a doctor or a hospital and the government pays the bill. And I know that some of you are probably screaming socialism right now, and yes, in a way it is, but I think that the great misnomer here is that the government owns and controls the hospitals and clinics and dictates where and how doctors can practice, and that wouldn't be the case. The government would just simply flip the bill for your care, but your choices wouldn't change. There's already a lot of programs that we have that are like this with, Medicare, Medicaid, the Veterans Administration. We have different like S-chip programs for state aid to children, and these things already exist. I think if we created one big program that could cover that, but that's not even a discussion we can have because we have what we have right now. And as I said, the political climate in America is never going to allow for such a system. So we go forward with what we have, and the question is how do we continue to improve upon it?
If we all do nothing, then nothing will be done. And if you think it's getting bad, it's only just begun. If we all do nothing, then nothing will be done. And if you think it's getting bad, it's only just begun. Lack of understanding is unsurprising when you read the daily lies and then watch the lies attend. Lies are bent, broken, mangled, distortion of the truth. If you want the facts untangled, of course you need some proof, indeed a sleuth. Track the facts down, flat foot, leap from roof to roof. Stoop to sweep will beat steep, teach, leak to cheat. People equally, truth and elders seldom held as such. But they are anyway, our illusion is a crutch. Supposed to take low pace, say thank you very much. Just stand up, nobody gotta take this shit. Not a bit, Blair gotta quit, just stand up. Anybody gotta take this shit, not a bit, gotta quit. What is it, we must stand up. Everybody everywhere, gotta fairly share the wealth. Just stand up, if not for yourself, for somebody else. They sent me more than 20.
So to begin, I want to cover what is actually in ACA. Now, I could spend several shows going over this. It's quite an extensive bill. The index itself is 12 pages. The bill is 906 pages. So I'd like to touch on some of the key provisions. But if you'd like to check out the bill, a link to it in PDF form is available on the show's website, lrtmpodcast.com. And I strongly urge you to do that. You don't have to read the whole thing, but you can read through the index and pick out key sections of the bill that might affect you and your family and your family's health care. Or if you own a business, how it would affect your business, things along that line. But inform yourself. I say this because there's a meme that has continually popped up on Facebook that tells me that some people, and I would suspect that it's probably most people, have no clue as to what's actually in the bill. And this is the meme. It says, Mr. Obama, instead of penalizing the people for not having health insurance, why don't you penalize the insurance companies for making their premiums so high the people can't afford them? Sincerely, an American taxpayer. Well, there's some truth to this. If you don't have insurance, you're going to be penalized. But, to say, why don't you penalize the insurance companies for making their premiums so high? Well, there is provisions within this bill that are going to work to keep premiums low. They're going to monitor the insurance companies to make sure that they're not doing some of the things that they've done in the past as far as raising premiums. And there's guidelines in it so that the insurance companies actually have to report on where the money's going and what they are doing. So there's a lot of checks and balances for the insurance companies now, too. And things like this that kind of come across Facebook as these fun little memes, and they'll pick and choose a certain thing out of a bill, and this happens on both sides of the aisle, and it really kind of misinforms people, and people will run with things like this. Like I said, as for me, one of the key provisions in the bill, and probably one of the most important things, and something that was needed, was the consumer protections that are put inside this bill. And if you remember in the last episode, Healthcare 1.0, I covered what the GOP is proposing as a replacement to ACA if they should repeal it. One of the keys to their proposal was, and I took this straight from GOP.gov, this was basically their platform for repeal and replace, and the header on this is ensure access for patients with pre-existing conditions. And then the text for this said, healthcare should be accessible for all, regardless of pre-existing conditions or past illnesses. We will expand state high-risk pools, reinsurance programs, and reduce the cost of coverage. We will make it illegal for an insurance company to deny coverage to someone with prior coverage on the basis of pre-existing condition, eliminate annual and lifetime spending caps, and prevent insurers from dropping your coverage just because you get sick. Well, this is all in ACA and more. Section 2711 talks about no lifetime or annual limits. Section 2712 talks about prohibition on rescissions. Section 2713 talks about coverage of preventive health services. Section 2714 is extension of dependent coverage. That's not in the GOP bill. What that does is allows you to keep your children on longer if they're in college. So, one of the hardest things is for 23, 24, 25, 26-year-old kids to get decent health care coverage if they don't have a decent job. Section 2718 is bringing down the cost of health care coverage. Section 2794 is ensuring that consumers get value for their dollars. Section 1101 is immediate access to insurance for uninsured individuals with a pre-existing condition. Section 1102 is reinsurance for early retirees. Section 1103 is immediate information that allows consumers to identify affordable coverage options. And there's many more to this. I just picked out a few of them. And so I'm not going to go into details on these sections, but as I said, check out the bill yourself. There's a lot of protections here that were much needed, and given that the GOP would implement most of them if they should repeal and replace, I think that both sides can agree that these are good things, and we should work together to ensure that they do indeed get implemented. In other words, I'm saying let's not let the insurance lobby work to weaken these provisions. These consumer protection provisions have come to be known as the Patient's Bill of Rights, and a link to a healthcare.gov article found at the show's website covers what that entails. A section titled Benefits of Consumer Protection says that The new rules will bring immediate relief to many Americans and provide peace of mind to millions more who are only one illness or accident away from medical and financial chaos. So the rules will achieve greater cost savings by, they list 4 items here. First one is reducing the hidden tax on insured Americans. So by making sure insurance covers people who are most at risk, there will be less uncompensated care, and the amount of cost shifting among those who have coverage today will be reduced by up to $1 billion in 2013. Second point is improving Americans' health. It says by making sure that high-risk individuals have insurance, the rules will reduce premature deaths. Insured children are less likely to experience avoidable hospital stays than uninsured children, and when hospitalized, insured children are at less risk of dying. Third point is protecting American savings. It says that high medical costs contribute to some degree to about half of the more than 500,000 personal bankruptcies in the U.S. in 2007. These costs borne by individuals might be assumed by insurance companies once rescissions are banned, annual limits are restricted, lifetime limits are prohibited, and most children have access to health insurance without pre-existing condition exclusions. The fourth point is enhancing workers' productivity, and it says that making sure that kids with health problems have coverage will reduce the number of days parents have to take off from work to care for family members. Parents will also be freed from job lock, which occurs when people are afraid to take a better job because they might lose coverage for themselves or their families. Again, for me, the consumer protections are what I value most in the bill, and I think that this is where the two sides should, in theory, agree the most. So encourage your representatives to work together to ensure that these measures don't get watered down. Now, Section 2 through 4 of ACA calls for health exchanges. Again, this is something the GOP would implement if they were to repeal and replace, and here's what the GOP.gov proposal says. The banner on it is Purchase Health Insurance Across State Lines, and the text for it says, Americans residing in a state with expensive health insurance plans are locked into those plans and do not currently have an opportunity to choose a lower cost option that best meets their needs. We will allow individuals to buy healthcare coverage outside of the state in which they live. And here is what is actually in ACA. So Part 2 of ACA is Consumer Choices and Insurance Competition through Health Benefit Exchanges, which contains Section 1311, Affordable Choices of Health Benefit Plans, Section 1312, Consumer Choice, Section 1313, Financial Integrity. Part 3, State Flexibility Relating to Exchanges, has Section 1321, State Flexibility in Operation and Enforcement of Exchanges and Related Requirements. Section 1322, Federal Program to Assist Establishment and Operation of Nonprofit Member-Run Health Insurance Insurers. Section 1323, Community Health Insurance Option. Section 1324, Level Playing Field. Part 4, State Flexibility to Establish Alternative Programs. Section 1331, State Flexibility to Establish Basic Health Programs for Low-Income Individuals Not Eligible for Medicaid. Section 1332, Waiver for State Innovation. Section 1333, Provisions relating to offering of plans in more than one state. So again, there isn't enough time to parse each of these sections, so I encourage you to look through the bill yourself, do searches for publications that have analyzed what's in the bill, and decide what you think about it. I'll provide some links at the show's website that analyze the bill, but please do your own research. But I think here, both sides can again agree upon the basic principles of this section of the bill. The GOP would propose exchanges such as this in their bill, and there are protections in it that still allow states a lot of flexibility as to how they would implement measures, or if they would have to implement those measures at all. So let's move on to the issue of taxation within the bill. Now, in the opening audio clip, Lindsey Graham said that the people will be taxed by hundreds of billions of dollars. And then here's what Rush Limbaugh had to say about it.
And we, the American people, have just been deceived in ways that nobody contemplated. What we now have is the biggest tax increase in the history of the world.
So what is the truth here? Well, an article in Forbes reveals the reasoning behind how this is seen as the largest tax increase in American history. Now, I don't know about the history of the world, but who am I to doubt the great historian Rush Limbaugh? However, the reasoning for calling it the largest tax increase in American history is specious at best. And this is what the article has to say. The mandate has two parts, the requirement to have coverage and the penalty, or tax, for not getting it. Why aren't both considered a tax? ABC's George Stephanopoulos did. When he directly challenged the president on the mandate as tax question, he said, under this mandate, the government is forcing people to spend money, fining you if you don't. How is that not a tax? Now, I think here Stephanopoulos was only referring to the second part when he was asking how is this not a tax, but I think that this article is trying to put words into Stephanopoulos' mouth and saying that he believes both are a tax. But I'll continue with what the rest of the article says. So it says, and if both the premium and the penalty are considered a tax, the mandate becomes the largest tax increase in U.S. history. And that doesn't include all of the other taxes imposed by the legislation. The median U.S. family income is about $50,000. Family health coverage can easily run $20,000 a year and rising quickly. In that scenario, the coverage mandate is essentially a 40% tax on that family, which is now required by law to ensure that every family member has qualifying coverage. And because the cost of coverage will be similar even though incomes vary significantly, the lower the income, the higher the effective tax rate. In essence, the most regressive tax in U.S. history, too. Now, President Obama and his enablers may deny the health insurance premium is a tax, but the bill's defenders, including Budget Director Peter Orszag, Health and Human Services Secretary Kathleen Sebelius, and the President himself, not to mention Democrats in Congress, also denied the mandate was a tax. So here's the problem with this argument, and set aside what the Congress said was or wasn't going to be a tax, because both parties play word games all the time to get the results they desire. Now, this article basically claims that because you are now mandated to have coverage, and remember that this was something that conservatives have been championing for 2 decades, any money you pay for coverage is now a tax, which is ridiculous. First of all, most people get their insurance through employer coverage and don't pay much, if anything, out of their pockets for the premiums. The individual costs come from deductibles and what their insurance doesn't cover. And again, these people already had this coverage pre-ACA, and it's not going to be affected. Moreover, there's many provisions within the bill that's going to assist those with low income to acquire the coverage they need. So again, this mandate isn't there to tax people and raise revenues. It's there to push people onto the rolls of the insurer so that there are more people in the market, and then the power of the market will provide lower cost and better coverage. Now, the penalty for being insured could be called a tax, but it could also be called a fine. Get insured and you won't have to pay the fine. Kind of the same as don't speed and you won't have to pay the ticket. Is a ticket a tax? And if the argument is that since the government is forcing you to be covered, it is therefore a tax, I would argue that any state that has adopted a voter ID bill has actually implemented a tax, because you must purchase an ID to vote if you don't currently have one. And these bills are all GOP sponsored, so the GOP is taxing you to vote in many states. But look, this is all semantics and they don't move the conversation forward. Now, in another Forbes article, linked directly from the article I read previously, this is what it said about the tax or penalty, whichever you want to call it, for not being insured. It said, starting in 2014, anyone not buying qualifying health insurance must pay an income tax surtax. It goes up each year until 2016 and beyond, when a couple would pay a tax of the higher of $1,360 or 2.5% of adjusted gross income. Now, the first article I read stated that the median U.S. family income is about $50,000. Family health coverage can easily run $20,000 a year and rising quickly. In that scenario, the coverage mandate is essentially a 40% tax on that family, which is now required by law to ensure that every family member has qualifying coverage. But according to the actual facts, a family making the median $50,000 that wasn't already insured would pay the tax penalty of $1,360 because 2.5% of $50,000 is $1,250, so the higher amount would be paid, which is about 2.7%. That's quite different than the 40% number used in the first article. And I asked, what are the chances that a family with a median income does not currently have coverage? Well, according to Dr. Mark J. Perry, a professor of economics and finance in the School of Management at the Flint campus of the University of Michigan, in 2010, there were 8.8 million Americans without health insurance in households making between $50,000 and $75,000 a year, representing 17.7% of the uninsured. Now, this 17.7% is those making $50,000 to $75,000. So what is the actual percent for $50,000 earners? Well, we don't know that for sure, but let's assume it's around 10%. It could be a little higher, it is likely a little lower, but let's just use 10%. So 10% of those making the median family income would be taxed or penalized under the individual mandate in ACA, and the penalty or tax would be $1,360 or 2.7%. I don't think that this is as dire as the proponents would have you think. And again, why does the individual mandate exist? And I can't keep kicking this dead horse hard enough. It was originally proposed by the GOP and championed by them for 2 decades. It exists to get more people into the market so that the market forces will work to curb prices and improve care or coverage. And the Forbes article presents other ways that the people will be taxed through ACA. It actually lists 7, and the individual mandate was the first, which I just covered. So number 2 is the over-the-counter drugs trap. And it says, since January 1st, 2011, employees with health savings accounts, flexible spending accounts, or health reimbursement accounts have no longer been able to use pre-tax funds stashed in these accounts to buy over-the-counter medicines for allergy relief and the like without a doctor's prescription. There's an exception for insulin. So basically what this is saying is you can't take money out of your flexible savings account to pay for things such as over-the-counter medicines like allergy relief, and it does exclude insulin. So it's basically saying that you can't pay for things like aspirin and allergy relief and things like that with pre-taxed money. And I don't necessarily see a problem with that. I think this right here was actually a loophole that they filled. And it's excluding insulin, so if you're somebody who has to purchase insulin, You can take money out of your health savings account and pay for your insulin. I think that's a good thing. But, over-the-counter things such as allergy relief and aspirin, things like that, I don't know if there should be a tax loophole that says that you can set money aside to pay for things like that. And this was a loophole that was filled. And I would also suspect, and I'm not going to dig into the research on this because there's so many other things to look into, that this was probably something that the AMA fought for, so that more people would have to go to their doctors, see their doctors, and get a prescription to get certain things to have them covered now that this loophole is filled. But once again, I don't have any proof for that. It's just something I would suspect. Number 3, the Healthcare Flexible Spending Account Cap. It says starting January 1st, 2013, employees will face a $2,500 cap on the amount of pre-tax salary deferrals they can make into a healthcare flexible spending account. There is no cap currently under the law. In light of the new cap, employees' benefits groups are lobbying for Congress to modify the use or lose it rule that means employees forfeit unused funds in their accounts at the end of the plan year. Now this one right here, I definitely could see where it needs to be modified. Now, $2,500, that's the cap that could be looked to be raised. But previously, there was no cap at all, which means you could dump as much money you wanted into this account, which would be pre-tax. So, I think this is where both sides could work together to try to come up with a compromise. Raise the limit over $2,500, but I don't think that there needs to be no cap whatsoever. Number 4, the medical itemized deduction hurdle. So starting January 1st, 2013, taxpayers who face high medical expenses will only be allowed a deduction for expenses to the extent they exceed 10% of adjusted gross income, up from 7.5%. Taxpayers 65 and older can still use the old 7.5% threshold through 2016. And again, this is where both sides could work together to try to work with this percentage, maybe raise it a little over 7.5%, maybe back up to 10% to everybody, but it's something that could be discussed, something that could be compromised. Number 5. The Health Savings Account Withdrawal Penalty. Since January 1st, 2011, taxpayers who withdraw money from health savings accounts for non-medical expenses before age 65 face a 20% penalty, up from 10% before. Again, this is probably someplace where they could work together to try to adjust the penalty on this. I think that a penalty such as this is good because you're putting this money away for a health savings account. So say you want a new TV and you decide you're going to pull it out, well, you should be penalized for it because you're essentially setting money aside that could be taxed and then pulling it out for something other than a medical service. So, is 20% too steep? It used to be 10%. It's something that definitely could be discussed, but, I understand why that penalty is there. And number 6, the Indoor Tanning Services Tax. Since July 1st, 2010, folks using indoor tanning salons face a new 10% excise tax. This is similar to taxes that are put on cigarettes or alcohol or things like that. And, I don't have a problem with a tax like this. Is 10% too steep? I don't know. I don't tan, so it doesn't really affect me. I'm sure if you're somebody out there that likes to tan, you probably really hate this. But, it's something that could be discussed. Drop it a few points, whatever. But, these are things like this tanning service tax, or when they put taxes on cigarettes or alcohol. It's ways that politicians, and they do this on both sides of the aisle, it's ways that politicians try to raise revenue without actually, putting a broad tax out there on everybody. Number 7, the Cadillac Health Insurance Plan Tax. Starting in 2018, there will be a new 40% excise tax on taxpayers who are covered by high-cost health insurance plans with premiums at or above $10,200 for a single or $27,500 for a family. Now, this is definitely someplace where the two sides get together and try to modify this. Obviously this is a tax on the wealthy, but 40%, that's pretty steep, and that's someplace that we could really look to see if that's fair or what can be done to modify that. And so the reality is that most people won't be taxed or penalized under the individual mandate in ACA, and that other taxes in the bill are measures to either close loopholes or adjust taxes that already exist. Now can we debate where these taxes can be modified? Sure. I discussed it in a few of the things that I covered here. But that's going to take both sides working together to come to a compromise. And I think we could look to raise the flexible spending account cap, but I think that there should be a cap, which there wasn't previously. And I think that the Cadillac Health Insurance Plan tax is excessive. And so there are areas that I think the two sides could work together and improve the bill, but I'd love your thoughts on it.
I know I've been making you think about it. I know you'd rather not. I've tried wrapping your head around it, tying it up in a knot. Sometimes I forget who I'm talking to, speaking to you all wrong. My sentences are a bit too short and my words are far too long.
So I've talked about ways in which ACA will affect individuals, but what about businesses? How will ACA affect them? So first, I'd like to focus on small businesses. A report issued by the Kaiser Foundation titled Explaining Healthcare Reform, How Will the Affordable Care Act Affect Small Businesses and Their Employees, succinctly lays it out in 3 pages. And you can link to this at the show's website, lrtmpodcast.com. So the report begins by stating, several provisions of the Affordable Care Act will likely have significant effects on small businesses, their employees, and families. Currently, smaller businesses are less likely to offer health insurance coverage for their employees than larger companies. 57% of small businesses with 50 or fewer workers offered health benefits to employees, compared to 92% of businesses with 51 to 100 workers and 97% of businesses with 101 or more workers in 2011. So the key provisions that the report mentions are that the ACA permits those small businesses that wish to keep the insurance plan they currently have to do so. There is a creation of insurance exchanges, which means that small businesses will have the option to purchase insurance through a new market called the Small Business Health Options Program, or SHOP Exchange. The exchange will be designed to offer individuals and small employers an easier way to compare and purchase plans. Employers may continue to purchase insurance through the market outside of the exchange, meaning that they don't have to necessarily be within the SHOP Exchange. There are penalties for not providing affordable coverage. It says that though there is no requirement that small businesses offer health insurance, beginning in 2014, some smaller businesses with more than 50 employees will have to pay a penalty if they do not offer affordable coverage. It says that businesses with 50 or fewer full-time employees are exempt from these penalties, and businesses with 51 or more full-time employees will be fined $2,000 per employee, but this excludes the first 30 employees. So say if you have 51 employees and you don't insure, you would be penalized for 21 employees. If they do not offer coverage for employees who average 30 more hours per week. It says note that there is no penalty for part-time employees not offered coverage. There are also tax credits to assist in the cost of health insurance for small businesses. It says that small businesses with fewer than 25 full-time employees may be eligible for tax credits to assist in the cost of health insurance. To qualify, such businesses must have an average annual wage below $50,000 and must pay at least half of the cost of their employees' health insurance. And there are 2 phases to this tax credit. I'm not going to go into these, but you can check out the link to the report for more info if you like. And then there's also grants for wellness programs. So small businesses with fewer than 100 employees who work 25 or more hours per week on average that did not have a workplace wellness program effective March 2010 are eligible for grants to start such programs. Now, I've heard opponents of the bill say that ACA would kill small businesses, but I think what this report tells me is that it should actually help small businesses. And how? Well, if small businesses are more easily able to insure their employees, and remember the report states that 43% of small businesses with 50 or fewer employees don't currently offer health coverage, I think that these businesses will be able to compete for better labor. Ask yourself, what is the one key thing that you look for in a job other than the wage that you're going to receive? And I bet it's the kind of medical benefits that the position offers. And some people put medical benefits first. I know this because I managed retail stores for nearly a decade and interviewed hundreds of people for positions. And the first question most interviewees had for me was, what kind of medical benefits do you offer? ACA does not force any small business to change their coverage and will not penalize any business under 50 full-time employees. Moreover, the health exchanges should help business find coverage for their employees. The nonpartisan CBO, which is the Congressional Budget Office, estimates that, and this comes directly from the report, approximately 2.6 million small business employees will get coverage through the exchange in their first year, which is 2014, increasing to approximately 3.7 million employees receiving coverage through the exchanges in 2017. What might be the downside to this? Well, I don't see any if you have under 50 full-time employees, because you're not required to change your current coverage, and you won't be penalized if you choose not to cover your employees. However, if you do employ 51 or more full-time employees, you are looking at a $2,000 fine per employee if you don't offer coverage. And of course, that's excluding the first 30 employees. But remember that the report states that 92% of businesses that fall into the 51 to 100 full-time employee category and 97% in the 100-plus full-time employee category currently do provide coverage for their employees, meaning only 8% in the 51 to 100 category and 3% in the 100-plus category would need to provide coverage or face penalties. And this doesn't take effect until 2014, so they have time to prepare for this. And again, there's also going to be exchanges in which business owners can shop around for the best coverage for their businesses. Now, what about large businesses? Well, an article found on Huffington Post might make you think that there will be dire consequences if you just look at the headline, which reads, nearly 2/3 of employers expect health benefit costs to rise under Obamacare, survey finds. So this is some of what the article had to say. It says, not only would workplace pizza parties cost up to 14 cents more per pie thanks to Obamacare, but a majority of employees also expect to pay more for employee health benefits because of health care reform. 61% of employers say that they will have to pay more for health benefits when key provisions of the Affordable Care Act take effect in 2014, according to a new survey of 1,203 employers by the consultant firm Mercer. 1 in 5 expect employee health benefits costs to rise by at least 5%. The survey included some small employers. 38 of the employers in the study have fewer than 50 employees. So remember, they really actually won't even apply because they don't have to insure, who will see fewer effects of the law. So really, if you take out those 38, you're looking at 1,165 surveyed. And, paying more for health benefits doesn't mean that the cost of healthcare will go up. It simply means they're going to pay more for health benefits, meaning that they're actually going to have to insure their employees, which is going to raise their health benefit costs. And is that a downside? Well, of course it is. But, that's kind of what this whole thing is about, is trying to get people on the role of having healthcare so that everybody is in the market. And, if the employers aren't paying for their health care, who is paying for the health care? The taxpayer is. They're going to be on the public rolls. So, what's the option here? My option is that everybody should be on the public rolls. I know the conservative option is that no, everybody should have their own private insurance. So, what's the middle here? The middle here is that the employer should pay for the health care, or at least part of the health care. The article goes on to say that healthcare reform will likely cost the most for companies that pay their employees little and have a large part-time workforce. That is because the Affordable Care Act requires large employers to provide healthcare coverage to all employees working at least 30 hours per week or else face penalties. I've read this sentence about 100 times, and it's just a major contradiction in the sentence. It says healthcare reform will likely cost the most for companies that pay their employees little and have a large part-time workforce. So if they're part-time, they don't even count on the rolls. But then it goes on to say that the Affordable Care Act requires large employers to provide health care coverage to all employees working at least 30 hours per week or else face penalties. It said it doesn't. I've read it 100 times, and this sentence does not make sense to me. It's an absolute contradiction, basically mentioning that these employers have a large part-time workforce, but they're going to be penalized under the Affordable Care Act, which wouldn't be the case because you're not going to get penalized for a part-time worker. So anyway, I'm going to read on. About 1 in 4 employers and 1 in 2 employers in retail and hospitality said in the Mercer survey that they will have to take action to avoid penalties. What does this mean? And this is only my assumption, that they're actually going to reduce the number of people working full-time so that they don't meet these quotas and they won't get penalized. And of course, that is a huge downside if they start really cutting their workforce to make it so more people are part-time than full-time. To me, that goes on the conscience of the business owner itself. I mean, how can the government be responsible for the conscience of a business owner? Further in the article, it says that only 6% of employers, including 9% of retail and hospitality companies, said they will likely drop their health benefit plans because of the Affordable Care Act. And again, this doesn't make sense to me because if they drop benefits, they're going to face penalties. I would suspect that they're going to change their benefits or do, as I said earlier, is cut the number of full-time employees they have. And so this study comes after Papa John's Pizza founder and CEO John Schnatter said earlier this month that he plans to raise the price of each pizza by 11 to 14 cents to offset new costs under Obamacare. And again, what are these new costs? It's not that healthcare may cost more, it's that he's actually going to have to insure his employers. You know what? I give kudos to Schnatter because he's looking to the future. He's trying to think about what he needs to do in order to take control of the situation when Obamacare takes effect. And what is that? Well, he's going to raise pizzas by 11 to 14 cents. And I don't mind paying 11 to 14 cents more for a pizza if that means that his employers are going to be covered. And I think that that's what more businesses do over the next few years is look to see what the cost is going to be and how they need to augment that. And if you have to pay a few more pennies at the store for a product so that somebody can employ their employees, I think in the end, that's going to work out better for everybody. And to be sure that some businesses are going to have to restructure over the next few years in preparation for the penalties they might face, but I doubt it's going to be the 2/3 that the article suggests. Some might increase the amount of their product, such as Papa John's. And remember that Kaiser report stated that 97% of businesses employing over 100 workers currently provide coverage to their employees. The question is the coverage adequate? So let's look at America and the world's largest corporation, Walmart. The 2005 documentary Walmart, The High Price of Low Cost, offers some intriguing insight into the retail giant's practices concerning providing benefits to their employees. The following audio was taken directly from that film. And other than the news clips, which you should be able to recognize as such, the voices you'll hear are all current or ex-Walmart employees. Some were store managers or higher. Now listen to the audio, and if you like, watch an extended clip through a link on the show's website.
You talk about using the system. Look at the way Walmart is using the system. They're promoting people to go to Healthy Kids and to get food stamps and Section 8 housing, and they're the ones that are using the system.
Yeah, it's pretty bad when you need to tell your employees that all these programs are available for you because we're not paying you enough money.
Retail giant Walmart is encouraging its workers to go on welfare.
Instead of paying for its employees to have health benefits, she says Walmart is making the government take care of it.
In Florida, Walmart has more employees and family members eligible for Medicaid than any other company. Critics accuse the retail giant of using Medicaid and state programs for the poor as its health care plan.
This report from UC Berkeley researchers concludes Walmart costs state taxpayers $86 million a year and county taxpayers as much as another $25 million to pick up the tab for public health care, income tax credits, housing subsidies, and food stamps.
Evelyn Dees used to work full-time for Walmart, but didn't have company health care benefits. She literally couldn't afford to pay for it, so she turned to government assistance.
What the public doesn't understand is that those everyday low prices are based on taxpayer subsidies. Walmart is getting away with it because they can.
I talked to the regional personnel manager about who was going to take care of the Walmart associates and their health care needs, and he said, let the state do it.
The personnel manager told me personally that there's assistance out there for people. They should be able to go use it. Use your taxpayers' dollars.
I had a list of all of the government agencies and all the different places that people could go if they needed money for their utility bills, if they needed to apply for food stamps, or if they needed to apply for WIC or for Medicaid.
Come up with some type of health care that a full-time person can afford and don't have to put on the scale health care or feed my family.
Why is it that a corporation that in 2003 had an outstanding $240 billion in sales would not provide a livable wage and affordable health care for their employees?
There's nowhere around that there's a company that makes this much money and still turns around and makes their associates go to the state for aid.
What this clip is telling us is that Walmart had a policy of encouraging their employees to turn to the government for benefits, and those benefits, of course, come from tax dollars. However, in 2007, according to a New York Times article, Walmart did begin to offer better coverage to a greater number of workers, and that actually included part-time workers. But then, according to a Business Insider article in October 2011, Walmart gutted its benefits package, rescinding health coverage for part-time workers and drastically raised premiums for much of its full-time staff. And when Walmart ranked number 1 on the Forbes 500 in 2011, and depending on which publication you read, grossed a profit of $4 to $6 billion in that fiscal year. So why can't they provide adequate coverage to their workers? Look, when it comes to many businesses covering their employees, there's no easy solution here, because of course most businesses aren't Walmart. But businesses, especially large ones, should see the cost of providing health care as a cost of doing business, rather than passing the cost on to the government, meaning us. What we need to do is encourage both sides to work together to ensure that those businesses that do need help from the government to provide coverage for their employees are able to get it, and those that don't, such as a Walmart, don't bilk the system and reap record profits. And I'm not even going to go into the other subsidies Walmart receives to build stores or distribution centers while taking in billions of dollars in profits. And that could be a subject for another show titled Corporate Welfare.
And somewhere to the east, the sun is stirring, starting to light up the sky. And I'm lying here reliving the last few days, 'cause I missed most of them the first time. You know I've searched my heart to prove there's better ways to push and pull. Hey, whatever gets you through these days. Did I disappoint you? Leave a bad taste in your mouth? I thought that we could, I thought that we would, I was mistaken. You know I've searched my heart to prove there's better ways to push and pull. Hey, whatever gets you through these days.
So Before I begin to discuss how ACA will affect the budget and deficits, which is going to be the final section I'm going to talk about, I'd like to quickly run down a list compiled by East County Magazine published on March 22nd, 2010. And as always, a link to this is available on the show's website. I think this list does a great job of highlighting key provisions by year. So I'm going to just touch on a few points in each year, but definitely check it out for yourself if you like. So first year, 2010, it says insurance companies will be prohibited from dropping people's coverage when they become ill. Starting immediately, children can no longer be denied insurance because of pre-existing conditions. Adults with pre-existing conditions will be able to obtain coverage through temporary programs that will expire after new insurance exchanges go into operation in 2014. Parents may keep adult children on their policies until age 26, extending coverage for college students and young people seeking work or without coverage through employers. Insurance companies will be banned from capping lifetime benefits and restricted on limiting annual coverage. Health insurers must report annually on the percentage of premiums spent on healthcare and provide rebates for excessive medical loss ratios. All new healthcare plans must cover preventive services. Some small businesses can receive a tax credit to help provide coverage for workers. A lot of this is stuff that I've already talked about, but I'm just kind of rehashing a lot of it. A temporary program will also help companies keep health coverage for early retirees, age 55 to 64 through 2014. Expand low-interest student loans, scholarships, and loan repayments for health students and healthcare professionals to increase the workforce to meet patients' healthcare needs. Require providers to implement enhanced screenings to crack down on fraud and waste, and expand public health programs and public health policies. And those are just a few of the points from 2010. So in 2011, second year, bonus payments of 10% will be paid to Medicare primary care physicians and general surgeons. Medicare patients will be allowed a free annual wellness visit and personalized prevention plan service. Requires coverage of stop smoking programs for pregnant women. New health plans will be required to cover preventive services free at low cost. Pharmaceutical companies with sales over $5 million a year must pay an annual fee based on market share. Provides grants for states to set up systems to respond to consumer complaints about health insurance. And employers must disclose the value of health benefits to employees on their W-2 tax forms. So that means you'll be able to actually see what's being spent on your health care on your tax form. And those are just a few points from the second year. Third year, Medicare payments to physicians, this is 2012. Medicare payments to physicians will be reformed to enhance primary care services and encourage doctors to form accountable care organizations designed to improve care. Acute care hospitals will have incentives to improve quality of outcomes for Medicare patients. Hospitals will be provided financial incentives to reduce preventable readmissions. Fourth year, 2013. A national pilot program for Medicare will encourage doctors, hospitals, and other providers to improve coordination of patient care. Medicare payroll tax will rise to 2.35% from 1.45% for individuals who earn over $200,000 and married couples earning over $250,000. Sale of medical devices will be subject to a 2.9% excise tax. However, devices sold at retail to the public will be excluded from the tax. Fifth year, 2014. State health insurance exchanges will be open for individuals and small businesses, and I've talked quite a bit about these exchanges, or what this is going to do for businesses. Now, Medicaid eligibility will be expanded to include non-elderly people within 133% of the poverty level. States will receive increased federal funding to cover these individuals. Most Americans will be required to buy health insurance coverage or pay a fine. However, people earning up to 400% of the poverty rate, $88,000 at present, can receive health care tax credits to assist them. Health insurance plans will be prohibited from excluding people with pre-existing conditions. I'm not going to read all the rest of these, but there's still quite a list of them from that year. In the sixth year, I've got 1 point, which is 2015. Medicare will reward physicians with payments that recognize quality of care instead of volume of service. And then there's a few more, after that as it moves on to 2018. So definitely check it out for yourself if you like. So there's a lot of consumer protections there, as well as checks on the insurance companies or pharmaceutical companies, along with a few ways in which revenue will be raised. The article covers a lot more, so definitely check it out. And since I've mentioned revenues, I think this is a perfect segue into ACA and how it will affect budgets and deficits. And so according to the CBO and GEO, which is the Congressional Budget Office and the Government Accountability Office, the bill should drastically cut into the deficit over the next few decades. But the reports issued by the two are only estimates, and there is a caveat. The GAO report showed that in their baseline simulation, and this is a quote, there is a notable improvement in the long-term outlook under the baseline extended simulation, which assumes full implementation and effectiveness of cost control provisions. End quote. It's the assumptions of the full implementation that are the caveat. In an article by Sam Stein found at Huffington Post referring to the GAO report, Stein says, the report goes on to air skepticism from Social Security trustees, the Congressional Budget Office, and CMS actuary that those cost control provisions will be put in place. For that matter, they will be sustainable over time. But that is a problem that reform advocates would argue is worth having. Better to tinker with the cost control mechanisms, after all, than to have to restructure an entire bill because it failed to control costs in the first place. It's also worth noting that the GAO was fairly judicious with how they calculated its projections. It was assumed, for instance, that Congress would pass some form of doc fix in which Medicare physician payments rates were adjusted to grow with inflation. GAO also took into account the federal spending for the Children's Health Insurance Program, the CHIP program, and subsidies for the newly created health insurance exchanges. Even with these costs assumed, the overall grade for healthcare reform is a positive one, even if the country's fiscal future is deemed dour. So here is where the two sides need to meet in the middle and work to ensure that implementation does take place and tweaks along the way are made to help bring about the potential of the bill. And what is this potential? Well, the CBO report estimates that, and this comes from Ezra Klein of the Washington Post, and I've also included a link to the CBO report at the show's website. This is from the Washington Post article. The law is expected to spend a bit over $1 trillion in the next 10 years. The law's spending cuts, many of which fall on Medicare, and tax increases are expected to either save or raise a bit more than that, which is why the CBO estimates that it will slightly reduce the deficit, and that's over the next 10 years. And then it's got a parenthetical aside here that says there's been some confusion on this point lately, but no, the CBO has not changed its mind about this. And the article goes on to say, as time goes on, the savings are projected to grow more quickly than the spending, and CBO expects that the law will cut the deficit by around $1 trillion in the second decade. So the bill has the potential to drastically cut into the deficit, $1 trillion in the second decade, but it will take both sides working together to ensure that that does happen. Now, I've covered a lot of what's in the bill and what it might mean to individuals, businesses, and the deficits, and most of that has made the bill sound pretty rosy. But what might be the downside of the bill? Well, while the Supreme Court has decided that the individual mandate is constitutional, some might still take umbrage with being forced to purchase insurance. And what if you purchase insurance only to find that you can't find quality care in your area? Many people in rural areas will likely experience this. It could be upsetting to pay for something that you can't get. The bill does have provisions that will encourage more primary care in those regions, and I covered some of those in that previous list. But, there's no guarantees here. There are also no guarantees that the bill will cut into the deficit as it is designed to do. I think there is also uncertainty as to how your middle-tier businesses will be affected. I think that small businesses have a lot of protections in the bill, and your larger businesses are already providing coverage to their employees or can afford to buy it just being stingy, such as Walmart. But what are your thoughts? Are there things I haven't mentioned that you would like to discuss? What do you like? What do you dislike? Share it on the show's Facebook page. There's a lot of unknowns, and only time will reveal the truth. But this is the one known. We are going forward with this bill, and if we work together to ensure that it is properly implemented, we stand a chance to provide tens of millions of more citizens with health coverage, improve wellness programs, lower health care and premium costs, and reduce the deficit.
Steal my bike and suck me up, slash my face and stab my gut, and gouge out my eyes, I'll still find my way home. 'Cause the trains here run all night, and the strangers hope you're alright. They're not so mean, they know what it means to be human. Put a baby inside me, dry me out till I can't see, but don't walk away, don't let me be alone. Let me see your other side, show me that we have not died, and give me the cure, you know that it's in your nature.
Well, I guess it's time to wrap up Healthcare 2.0. Even though I broke healthcare into 2 episodes, I feel there is still much more to cover. So I encourage you to check out the links I provided at the show's website, lrtmpodcast.com, and please join the conversation on Facebook. Each show I've produced so far has had a small string of conversation between just a few people on the Facebook page. I would definitely like to see more. The purpose of this media project is to first and foremost provide information, but I'd also like to see a dialogue open up between the competing ideologies. As far as the past 2 shows go, I hope I've demonstrated that when it comes to the Affordable Care Act, most of what is in the GOP alternate bill was an ACA, and one of the main points of opposition, the individual mandate, was originally a conservative idea. So I think that both sides should be happy with the bill, and our representatives should work together to make sure it's properly implemented. But they're only going to do that if we, the constituents, continually prod them to do so. Please tell your friends and colleagues about the show and join the conversation on Facebook. I'll be back in 2 weeks with a show on Social Security. Until then, thanks for listening.
We sang it late, sang it long. We lit our flames, they were strong. It took so long, but we fought on and on.